is Dr. Robin Ostrander. I'm the Senior Medical Director at the Brattleboro Retreat, which is a nonprofit psychiatric and addictions hospital in Brattleboro. And I'm very excited to be here today with my guest, Joellen Torello-Falk, who I will allow to introduce herself. Joellen.
Very good. Hi, I'm Dr. Joellen Torello-Falk. I'm the Executive Director of the Center for Health and Learning. We're a nonprofit organization that was developed about 10 years ago as an outgrowth of funding from the Department of Education in Vermont. And our role and responsibilities are to leverage activities in the field that promote health, and we have a special focus in the last few years on mental health. I'm glad to be here today. Thank you.
One of the things I thought we might start with is how you and I got to know each other. So maybe I'll start with that. On May 10th of this year, about a month and a half ago, you and I co-hosted a workshop for the community, which we held at the retreat, which was in honor of Children's Mental Health Awareness Week. It's a week that happens in May every year. And there's a national organization called speakupforkids.org, which urges child and adolescent psychiatrists across the country to get out into the local community and try to do some education. So the Brattleboro Retreat's child psychiatrists have been participating in this event for a couple of years, and this year we were so excited to have you join us. So you and the Center for Health and Learning came, and we did a workshop on youth suicide prevention. So maybe you could say a little bit about what that was, sort of what we did.
I'd be happy to. And I just want to say something about the focus on mental health. When we think of health, we think of the balance between the physical, mental, emotional, social, spiritual, and environmental factors of a person's life. And so we are a comprehensive health organization, and we're always thinking about the links between our physical health, our mental, emotional health, and how that manifests itself in terms of our social health with our relationships with ourselves, most importantly, and with each other in our families and schools and communities. And as a result, we are very excited to participate in activities around mental health promotion because there tends to be a lot of emphasis on physical health, and people are much more able to talk about physical health. When they go to their primary care doctor, they expect to talk about, their risk for chronic disease like diabetes, obesity. They expect to talk about physical activity and nutrition and how they take care of their physical well-being. And increasingly, there's more and more of an understanding that we're not as good about talking about our mental health and our social health needs, and that those are absolutely important to how we feel in the world and ultimately the way we cope with life, which presents us with innumerable problems and issues as we go along. So Mental Health Promotion Week was an opportunity for us to partner with you as a preeminent mental health institution and hospital in Vermont around the promotion of healthy health behaviors and what we do when we see that people are struggling. We wouldn't let a kid fall down, break their leg, and walk away and ignore it. And yet kids, adolescents, and the focus of our discussion today is really on ages 11 to 23, although it extends into everything we talk about will extend into the adult community, but our recent focus has been on youth and young adults. And we need to become better at identifying the signs of in youth that indicate that they need help. So participating in Mental Health Awareness Week with you and doing that workshop was an opportunity for us to contribute to increasing that understanding and helping people out in the community, whether they're parents or professionals, recognize when mental health needs to be addressed.
I think that's an amazing introduction. One of the things that we at the Brattleboro Retreat do is treat individuals and families. So since the mid of 1800s, we've been having people come to us for help with addictions and mental illness, but we aren't always meeting everyone who needs our help. Many people who need mental health treatment will never receive it. And a large reason, which you alluded to, is stigma. So it is much more difficult to talk to anyone about a mental health problem. And it takes an inordinate amount of courage to be able to go to a primary care provider or a pediatrician or even to a friend and say, I'm struggling. I think that I'm depressed, or I think I can't control my drinking, or any of the number of illnesses that contribute hugely to death and morbidity in the population. So if we're just looking primarily at youth and adolescents and young adults today, suicide, homicide, and accidents are the main 3 causes of death at the top of the list, because younger people tend not to get other chronic illnesses. So you could argue that the top 3 causes of death for this age group are all preventable.
Exactly.
And so how could we walk away, or how could we not really focus efforts on education around what does mental illness look like and when should you get help? And so one of the things that I thought made sense for us to talk about is, well, how do you know? How do you know if someone is struggling? And why does it matter that you know that? If I'm a person on the street, why does it matter? I'm not a psychiatrist. I'm just a person on the street. Well, one of the first things I'd say about that is we all know someone who is young. We have children. Our children have friends. We might work with young people, at our place of employment, maybe young people are employed there. Our friends have children, or we might be in an occupation where we naturally come across a lot of young people. And in the mental health community, some people refer to these kinds of folks as gatekeepers. So when we say that, it's not really a technical term, but what we mean is if you in your daily life come across a lot of young people, you are someone who we would like to have a basic knowledge of what does a child in distress with mental illness or suicidal thoughts look like. So those kinds of people include police, clergy, teachers, nurses, Cub Scout leaders, coaches, emergency responders. You can name many, many more people who come across a lot of youth, or parents of teenagers. So even if your child is doing great, which is awesome, teenage is a hard time to be, your kids have friends. So as a parent, you really have somewhat, I would say, a responsibility to have some basic knowledge about what mental illness looks like in children. And if one of the main causes of a suicide attempt is a mental illness, then here's what it is. It's depression. So, but far and away, one of the major risk factors for suicide is depression. And there are a bunch of other ones, and they are not sort of sneaky. They're kind of obvious, but it's good to just have them in mind. So if you're thinking, is someone at risk for a suicide attempt or for suicide? Well, are they depressed? Have they ever made a suicide attempt before? Do they have access to what we call a means of suicide, which means do they have accessible firearms either in their home or from a friend? Do they have access to other sorts of lethal means, like pills that are not secured in a home, even old prescriptions that we've forgotten about that still are in the medicine cabinet? Is there a family history of suicide? If a child knows that there's a family history of suicide, they're even at higher risk than if they don't know. But just the mere fact that there has been a suicide in the family raises everyone's risk, and we think that's through sort of complicated genetic factors. And then, have they had a recent loss? So for kids and teenagers, it can look like a lot of different things. To us, the loss of a 2-week romantic relationship for a teenager might seem minor. To a teenager, it may truly be the end of the world for them in that moment. And suicide attempts happen in a moment, so it matters. For younger children, it may be things like a divorce or a loss of a family member, or not so much a loss of a pet, but a teacher moving away, a teacher dying, a friend dying. So those are some of the sort of the initial risk factors. I know you knew much more about this than I do, so maybe you want to add some.
Well, I think that what you're talking about are all of the elements and factors that affect us emotionally. And when I talk about emotions, I basically think about how we feel on a daily basis. And as you were just explaining, for children and youth and young adults, they have this incredible special quality and characteristic based on the stage of life they're in, that they are pretty much living in the moment, and they're feeling in the moment. And it's only through experience, a lot of experience, that we start to really understand that our feelings can change from moment to moment, and that we have some influence and control over our feelings. And so what an adult who cares about a child or youth can do is to begin to tune into them emotionally on a day-to-day basis. And when we're doing that, we're looking for changes in their emotional states that seem to be normal, and then at other times seem to be erratic and or not what we would expect to be typical. And when we start to see patterns of not what we would expect to be typical on a regular basis, that needs to be a sign for us that this kid or this person, this youth, is really needing us to check in and find out what's going on. And as you indicated, there can be a lot of things going on. I mean, life is complex for a youth. When you think about youth moving to a new community and what they need to cope with and tend to there, finding their niche and finding a group that they feel comfortable with, is a big challenge for a youth in a new community. Or any sort of family changes. We know that 1 out of 2 families go through some kind of a significant family change, and that could be divorce, it could be separation. We talked about moving. It could be even more significant loss of someone they love. And that person could have a disease and or be coping with some kind of a long-term illness themselves. And so those are kind of big factors, where they're living, what their family is experiencing. Then there's pressures on families around employment and money and income and all of the pressures in this world to own and buy things and material goods. And then there are the kinds of pressures that come from peer relationships. And so if there are things like any kind of bullying or harassment going on, if there are environmental factors at school that are causing them, to be distressed, then that child or youth may be at risk for wanting to find ways to cope with that. And you mentioned earlier substance abuse. You might want to talk a little bit about substance abuse as a coping factor, because when we start to see patterns of substance abuse emerging, that's a special concern for us to really tune in to emotionally what's going on with that youth. Could we talk a little bit about that?
Sure, absolutely. So one of the kernels of truth that really struck me about what you just said is we're looking for change. So in order to see change in kids, first we have to know what their baseline is. So we have to be tuned in to the youth around us, our own kids, other kids around us, so that we can notice when things are different for them. And one of the things you said is different. Are they just acting different? So they used to come down to dinner every night and they just stopped. Or their grades are now plummeting. Or they used to be involved in different kinds of sports and activities and they just say, nah, it's stupid, I'm not doing that anymore. Or their crowd of friends has changed in a way that outside adults might say, those kids aren't so healthy as the kids before. I can't always put my finger on it. It's not obvious. They're not all, addicted to drugs, or they're not all in trouble with the law, but there's just something about them. Maybe they're more risk takers, or maybe the child that I know just doesn't tell me anything about these new friends, or I can't get their parents on the phone, or those kinds of things. And then substance abuse is a big one. So it is common for youth to experiment with substances, and not every child who tries a drug has a serious mental illness or is at risk for suicide. That's the minority. Suicide attempts, thankfully, are very rare. But there is a link there. So there's a link in a couple of ways. One is, as you mentioned, is coping. So let's say I'm depressed, I'm a teenager, I don't feel understood, and I don't know how to deal with these feelings. Because I'm a teenager, as a child psychiatrist, we'll often say, well, the neural structures in the front part of your brain, which we call the frontal lobes, have not really pruned themselves appropriately for me to see the future. I cannot see that this feeling will pass. I can't sort of have some perspective around the fact that this thing in my life is bad, but these other things are still pretty good. That's really tough for teenagers. They just physically, their brains won't take them there. When they get to be their mid-20s, late 20s, they start getting there. So this bad thing in the moment is happening to me, and it's really the end. I can't see my way out of it. It's going to last forever. So how do I cope? One way I cope is by trying to make myself just feel different than how I feel. And many youth that I talk to as a clinician will say, well, I didn't want to become addicted. I wasn't going to become a daily marijuana user. I just felt really bad and I wanted to feel different. And when I smoked marijuana or when I drank alcohol or when I tried other drugs, I felt different. I forgot about my problems for a moment. Yes, they all came back, and no, they weren't any better, and maybe they were in fact worse because now I had my parents breathing down my neck, or I was afraid of the law, or other bad things happened. Children aren't dumb. They know that there are bad things connected to drug use, but they're kind of impulsive because of that brain thing, and they think that they're unique and that they won't get in trouble because they may overestimate their abilities to outsmart other people, and they just kind of in that moment need to feel different. So if you know a child who is starting to use drugs, or you think they're starting to use drugs, it's certainly worth a conversation, but about the drugs themselves. But a punitive, you must not use drugs conversation is not going to get at what you and I care a lot about today, which is about mental illness and suicide prevention. So it's important not to head into a conversation with a teenager with guns blazing, saying, I found out that you're smoking marijuana and you're going to stop. But as much as you can, to start out with some questions.
Like,
what's going on? Mm-hmm. I've noticed that you just seem kind of down. What's up? Mm-hmm. How's your life been? Mm-hmm. You seem kind of sad or blue or, I don't know, just mad all the time. Mm-hmm. And I care about you. So, two things I'm doing. One is I'm not offering a directive out of the gate. I'm not saying this is what you have to do, because you and I and everyone else doesn't really like to be told what to do. So if we're told initially what to do, then we'll start readying our response. Mm-hmm. Our this is why I don't need to do what you tell me to do. And teenagers and everyone else is pretty good at that. So if we start out with a question and also a statement of concern, mm-hmm. Yes, an observation, which means I care about you enough to notice you. Mm-hmm. I've been noticing you.
And when you do certain things, or when I've seen you stop being interested in school and sports, and when we're getting into fights and arguments a lot, and when you're putting your sister down or whatever it is, it feels to me like this isn't the you that I knew before and was used to, and that some things have changed.
Right.
And I'm just wondering what those are.
Absolutely. And you're giving sort of real examples.
Mm-hmm.
Here's the things I've noticed, not just I see you're different.
Mm-hmm.
Specific examples which kids might not be able to disagree with so much. Mm-hmm. And you're saying, I care about you. Mm-hmm. This is why it's worth it for me to have this conversation, because I want you, if you don't feel good, I want to help you feel better. Mm-hmm. Not because I want to get you in trouble or it's bothering me that you're doing X, Y, or Z because you don't clean your room. It's not about me. It's really about you and how much I want to help you. Mm-hmm. And, for youth, a lot of people tell them what to do all day long. Pretty much all the time. They don't have a lot of choices because they're not adults. So speaking to them as if they have a mind and they have choices, and not as if they are adults, but as if they're worthy of your respect, will get them to share with you a lot more than any other way.
Robin, that's so important. And one of the things with suicide prevention is being able to have the conversation that leads to the point where you can say, I've noticed that you have been drawing morbid pictures, or I've noticed that you are isolating and not hanging out with your friends, or that you've kind of given up on things. And take those real observations of real, what we call warning signs, which are signs that something really, that the person has come to a different place and that they might do something to hurt themselves or someone else. But in this case, we're talking about hurting themselves. That we're able to have the conversation and say, you know, I need to ask you, have you thought about hurting yourself? And if they say, well, actually, I have, that you can say, well, can you tell me about that? What have you thought? How have you thought of hurting yourself? And if they say, well, I've thought of just shooting myself, you know, or whatever it is, that you can immediately respond and say, that really concerns me and we need to get you help. And I'm going to stick with you until we get you help. And then your job is to find them help so that it doesn't have to rest on your shoulder. That's when I would look to a mental health professional like yourself, or go to the local mental health agency or some of the counselors in town, the mental health counselors in town, or anybody who has access to help and support. For some people, it's talking to a faith leader, and that faith leader will get them into a system of more advanced care. But being able to really follow up and know that none of those statements should be taken mildly. You can say to them, do you really mean that? Did you really mean? And would you do that? And then they might say, no, I'm just frustrated. And you can say, well, let's talk about your frustrations, and so that we can help to resolve those, you know. But if they say, yeah, I really do, then we need to go into high gear. Make sure that we stay with that person, get them to help, make sure that, as you said earlier, we absolutely restrict or contain or remove any access to anything with which they could hurt themselves. And that's what we call a real intervention.
Absolutely.
Is getting somebody to care and then restricting the environment to ensure that while they're in this crisis of emergency, that they do not have the means to hurt themselves.
Right, and that's a really important point. So people aren't consistently 100% suicidal throughout a day for weeks. They may be thinking about it. They may intermittently kind of make what we call a plan. A plan may be figuring out how I'm going to kill myself. I'm going to hang myself. I'm going to accumulate pills. I'm going to get a firearm. But at any given moment, they haven't made the attempt yet, which shows you how much ambivalence, how of two minds they are, because even youth know this is a really big decision, and they often don't undertake it lightly, which means we often have ample opportunity to get in there and help. And so I'm not saying that every person in the community needs to know how to intervene or needs to know all the questions that I might ask a person who we think is suicidal. But asking a question about suicide is not going to make someone suicidal. That is a myth. Often people are really relieved that you have asked them the question. They want to tell someone. If a youth makes a comment about suicide, as you said, Joellen, even if it seems kind of flip, take it seriously. Say, no, wait a minute. You said I would just shoot myself. Really? Tell me more about that. That's something that's scary. I'm interested in that. And if you have a reason to think this is more than just a random comment, then if you're not 100% certain that they're just joking around, then you go to the next step. If you're really scared, you can bring them to the emergency room. You can call 911 from wherever you are. That is okay. I mean, if one of the top causes of death for youth is suicide, it's okay to call an emergency responder when someone is suicidal. They do not need to be bleeding. They don't need to have a broken bone in order to evoke emergency services.
Well,
that is okay.
This is where we get into mental health first aid or mental health care, as we were talking about earlier. We wouldn't ignore a broken leg, nor should we ignore signs that somebody is really in distress. One of the things that really struck me about the meeting we had, the community forum, was how many different people came and were in that room. We had parents who had lost children to suicide and know the loss on such a personal level that they don't ever want it to happen to anyone again. We had mental health workers, we had physicians, we had law enforcement, we had first responders, emergency care workers, we had faith leader, we had youth serving, people who work with youth at the Boys and Girls Club and other places. So there are so many people in the community who kind of can come to the support and care and rescue if they know what to look for and what to do. And so what to do is take it seriously, check in, ask the hard questions, find out how, if this is serious and if it looks like it means what they're saying here, and get them to help. The emergency room is a reasonable response. Calling 911, calling even 211, which is our resource statewide, which will refer you to a local mental health agency or provider. In certain counties, there are emergency numbers that you can call. Calling your primary care doctor and getting them to relay to a mental health counselor. Those are all reasonable approaches, but sticking with it till you know that person is in the system of care can take some perseverance, and we need to be ready to follow through in that way.
Right. But what more important thing could any of us do than save a life in that moment? That any one of us as an adult in the community may have the opportunity to intervene and save someone's life. I can't think of a more important thing that we could do for youth. And, many of the people watching today are parents. And if they have lost a child, they know just the depths of despair that causes. Or if they even think about what would happen to my child if they had a medical illness, if they attempted suicide. You know that every child out there is someone's child, if not yours. And these simple things aren't simple in the moment. It's very, very difficult, but it's not complicated. It can be done, and any one of us can do it.
And one of the really touching things is that those who have attempted suicide and have not completed, they have not killed themselves, they will say that at the moment they were doing what they were doing, they had this moment that said, oh my goodness, what am I doing? I don't want to do this. And when they come through and get help and support and treatment and get into recovery, they look back and say, that was one moment of despair, and how glad I am that I made it through.
Right.
And that I got care and help. And now I want to help others.
Absolutely. And you speak to another myth, which is that it's no use intervening because if someone wants to kill themselves, they will. That is not true.
Right.
People don't 100% want to kill themselves. They may 100% want to feel better.
There's a lot of ambivalence and mixed feelings there.
Absolutely. They don't know how else to feel better, and they cannot tolerate how bad they feel right then. Mm-hmm. And suicide may seem like the only option. When you're very depressed, you think more rigidly. You don't come up with all the other possibilities of ways to feel better. So it's just that one. But at the same time, you're open to someone else stepping in and saying, you don't have to do this. Mm-hmm. And part of my daily work with youth is talking to folks who have made suicide attempts. And of the 40, 50 kids that I see in a week, maybe 75-80% of them have made a suicide attempt. This is a very intense sort of section of the children in mental health treatment in Vermont who have more intensive needs. But I look at them and think, what if we had lost all of you? And what a blessing it is that we didn't. And, I think we're sort of getting to the end of our time here, but I wanted to say one other extra thing about means when we talk about the means for suicide, because this is something that I hope people will get aware of and try to kind of divorce their political views about the means for suicide and civil rights from what it means for children. So we're just talking about children and adolescents right now. So there is a very easy access to firearms in Vermont and New Hampshire and other states around us. And I'm not saying that there shouldn't be, but what I am saying is that for children who are depressed or are struggling, it is very, very important for families who have firearms in their home to be extremely obsessive with how they take care of those firearms. Can I tell you how many times I've interviewed a child and said, how many guns does your family have? And they will tell me all of them, and I'll say, where's the ammunition? And they will tell me where all the ammunition is. And I'll say, where are the keys to the safe? They'll tell me where, the first set of keys is hidden here, and the second set of keys is hidden here. And then I'll interview the parents separately, and they will say, my child is clueless. They have no idea those guns are totally safe. And then I'll bring the two together and say, Johnny, tell mom and dad where the keys are, and they are just aghast. So your children are smarter than you when it comes to things that they are very curious about. And they, if they're in despair, are spending a lot more time thinking about this. You might not think about it at all because, the firearms are a hobby or they're for home protection or you're a hunter. It's not something you think about, but those kids are thinking about it. And there's real data to show that for every added weapon in a home, it raises the risk of death by suicide and homicide for every person in that home. And having gun safes, having trigger locks, separating ammo from firearms diminishes that risk a tiny bit. But it's still this curve that marches up. And that's very sobering to me. So it is so important to not just make sure you've locked things up, but remove them for a time being. If you have a child at risk, remove the firearms and tell the families around you who may have firearms, because often kids will get them from some other kid, to say, look, my child has depression. Please make sure you lock up your firearms because I know my son's going to ask your son about it.
Mm-hmm. Absolutely, Robin. That is so important. And I can sit here and speak and represent the Vermont Youth Suicide Prevention Coalition, which Center for Health and Learning facilitates statewide. There are over 25 member agencies in the coalition. And we have just published the Vermont Suicide Prevention Platform. And the platform is based on 10 national priorities and strategies for suicide prevention. And really being cognizant of lethal means, that is how the means that somebody could use to hurt themselves, kill themselves, and ensuring that those are not easy to access is an important strategy. And the Vermont Youth Suicide Prevention Coalition strongly supports separating safe storage of firearms, separating ammunition from storage, ensuring that only a minimum number of people have access to that, adults who can really monitor it, putting trigger locks, safety locks, child safety locks on it. And these are all actions that demonstrably can reduce risk. Massachusetts has some specific legislation around this, and their suicide rates went down significantly. And so we're attempting through education in Vermont to really raise awareness about the importance of that. And that includes prescription drugs, which is, a huge issue in Vermont as well. And just generally having those conversations with your youth too is very important. I think to end on a positive note, to be able to have these conversations with each other as adults, to recognize that every person in a community has a role, regardless of their profession or their role as a parent, an aunt, I know that personally, I had an experience in my young adulthood where somebody I cared about very, very deeply killed themselves. And that person had said something to me, said a couple things to me that had I known they were at risk or struggling emotionally, I would have been able to have recognized that the things they said to me was like, if I don't show up on Monday, what would you do? And I said, well, I'd be madder in hell, but I'd go ahead and, have the rehearsal in this case without you. Had I known that there was a risk, that I would have been able to have done something that might have helped. So it's important for all of us to recognize our role, the unique opportunity we have, and to be able to talk about mental health issues just like we would talk about physical health issues. You need a Band-Aid, wash off your wound and go put on a Band-Aid. Well, it looks like you're struggling and I care about you and let's do something here. And I'm going to be with you until we get you some help. And then make sure that you go to that helper, whether it's the emergency room or the call the counselor you've been working with, or whatever the means to help is that you can get.
Absolutely. So one of the things we'll do at the end of the program today is post visually for everyone some of the websites that people can access. So the website for your organization, the Center for Health and Learning, and a really unique, fabulous website directed at youth.
Yes. The Vermont Youth Suicide Prevention Coalition developed the You Matter campaign. And You Matter is a term that we chose because you matter, because you may be somebody at some point in your life that needs emotional support and help. And you matter because you may be somebody at some point in your life that could help somebody get to the help they need. And so we developed the youmatteryoucanhelp.com website for the adults who might want to help. And we developed the youmatteryoucangethelp.com website for youth. And it was specifically developed with a lot of input from youth. We won a national award from Joomla as website of the month for the design of our website for youth. And we really would like to see access. And if people want to post it on their Facebooks, send it to youth they know, and just use it as an ongoing resource themselves. You Matter You Can Get Help, or youmatteryoucanhelp.com. And thank you for mentioning that.
You're welcome. And there are a couple other hotlines, which we mentioned, which we'll also post,
Yes.
as far as making a phone call and
The
getting
National
help.
Suicide Prevention Lifeline and the Vermont 211, the Vermont 911, they are all equipped to be, funnels to local community resources for help.
Right. And the last thing I'd say is about the organization that I work for, the Brattleboro Retreat, which is a large organization in Windham County, serves children, adolescents, adults in the full continuum of psychiatric services. So outpatient care, residential services, acute inpatient, so psychiatric hospitalization for those in most need. And we have a website, brattlebororetreat.org. We're also on Facebook, and we'll post some information about how easy it is to get in touch with us. And we would be happy to take calls, even from people who aren't necessarily looking for our services, but are looking for help and don't exactly know where to go next.
Mm-hmm. We're very lucky in Windham County to have that kind of a resource, and for treatment and support and just referral. So I'd like to thank you for partnering with us on this initiative, and I hope that we can continue to do more community education in the future, and that people who are looking for training and resources will contact either you or I.
Absolutely.
Very good.
Thank you.